So from the point of view of a young Indian American woman going into the healthcare realm, notice how diabetes is very prevalent in our communities. I grew up with mostly non-South Asian friends until I went to college, and I realized when I got to college that many of my friends also have diabetes that run rampant in their families. So it got me thinking, why binary mismatch, which is no longer suitable and thus creates a conflict within our physiology. So a study done in 2016 revealed that one generation surviving a famine doubles the risk of diabetes and obesity in the next generation, even if they have not experienced a famine themselves. Because of this, the risk of cardiovascular diseases will increase 2.7 times within the next generation. And now, we're facing the repercussions of all this, and South Asians are 6 times more likely to have type 2 diabetes than the average non-South Asian person. So when we talk about prevention, I think we always hear about diet and exercise. I'm not going to bore you with the details. I will give you actual helpful tips that my own family has implemented. But it's important to know, as a student from a Jesuit school as well, caring for the whole body isn't just diet and exercise, it's also a mindset shift. So knowing that small changes can lead to big results is really important. And if you didn't know this, it only takes 30 days to get a habit to actually be set in stone. But it's also important to know the effects of colonialism happened, and it's upsetting, but it's only an explanation. It's not a solution. So I will talk about diet and exercise, even though we had a very large meal just an hour ago. But a lot of these things I've noticed at home. Every time I come back from college, there seems to be a new replacement in the foods that I used to love. No more Costco cookies, a lot more low-carb tortillas, no milk. Apparently I drink almond milk now. But it's important to know that all of these things are small ways that you can make changes. But the most important thing with diabetes is carbs. So carbs are impacting your blood glucose, and these can be categorized within starches, sugars, and fibers. And when you're reading nutrition labels, you should see that the total carbohydrate on that nutrition label refers to all 3. So it's important to choose carbs that are nutrient dense, so those that are rich in fiber, vitamins, minerals, and low in sugars. So one thing I've noticed since I've come home is I'm not eating 2 chapatis anymore. I'm eating 1 chapati and a gigantic salad. And in turn, this reduces portion sizes and also helps you include more greens, which we know is very important to our health. And also understanding food labels. There are so many apps out there, as we know with social media. One of the best things is there are apps on the App Store. You can talk to people, you can find Facebook groups and connect with people and create a community and find ways to actually implement changes. And we all know our lives are busy. We sometimes, after a long day at work or studying, we don't want to exercise. But NPR Life Kit did a study where they found that only 5 minutes of increasing your heart rate through walking every 30 minutes can offset the harmful effects of sitting at your 8-hour workday. Even if you walk 10 minutes after consuming a meal, you can reduce your blood sugar by over 60%. And as South Asians, there's nothing more important to us than family. So doing things as a family is a really good way to get things started. So preparing meals together, keeping each other accountable, and going on walks after meals are all good ways to start. And in terms of social media, one thing our generation is pretty good at doing is navigating through misinformation. As young people, we grew up in close proximity to mass information. We know that .org is more reliable than .com most of the time, and you don't want to rely on our favorite WhatsApp doctors, looking at all of the dads in the room. But all of our moms educate healthcare education just down the drain with one piece of misinformation they found on the internet. And of course, I have to give a shout out to our siblings who rely on TikTok for their medical information as well. But in conclusion, prevention begins at one choice. Just know that that one choice can make an impact for you, your children, and future generations, and hopefully we can reduce diabetes within the next few generations. We also have a pamphlet on our seats, if you haven't picked one up, that have all the resources that you guys need to kind of get yourself started. Thank you.